Good afternoon, my name is Kathy James. I'm a nurse practitioner and I work for Nanticoke Memorial Hospital. Presently, I'm a palliative care provider. Palliative care is specialized medicine designed for people who are dealing with serious or chronic illnesses. These illnesses might be cancer, COPD, congestive heart failure, chronic renal disease, dementia even, or failure to thrive. The specific agenda for palliative care is to approach how a disease is affecting a person and their family and to help them through some of those difficulties. That might be for the management of pain and other uncomfortable symptoms like shortness of breath, nausea, or vomiting. Sometimes I'm asked to see families who are just working through the psychosocial issues related to an illness that might mean the end of their life, or at least shorten it. Palliative care is different than hospice in that with palliative care, it can be offered at any point during your journey with the illness, whereas hospice is meant for those persons who have decided they want no further life-prolonging treatment and would like to live their way, either at home with their family or in a facility. Presently, palliative care is partnering with Delaware Hospice to help extend our services from inpatient to outpatient services. As a palliative care provider in the hospital, I'm consulted by physicians who have patients who they believe need an additional resource to help them work through some of the difficult psychosocial needs, spiritual needs, or just plain understanding about their options for treatments and the alternatives. After I've seen a patient at the hospital, sometimes I'm asked to help manage their pain or respiratory symptoms. We also are an interdisciplinary team, meaning we have access to social workers who can help with resources on the outside of the hospital. We have access to various hospices, but particularly we work with Delaware Hospice. They can help us with resources on the outside. I also have access to at least 30 volunteer clergymen who are willing to come at any time to help our patients as they work through the existential matters related to serious illness. The main thing with palliative care is that it offers the physicians and patients and family an additional resource to help as you're dealing with something very serious. It's part of the holistic care that Nanticoke Memorial Hospital wishes to provide. If you have more questions about the services of palliative care or the services of Nanticoke Memorial, please check online nanticoke.org.